Dr. Bibilash Babu, Chief Consultant Cosmetic Surgeon, Cosmetic Clinic, Trivandrum, Chakai, Kerala. Here we're going to speak about a very common problem with which male patients approaches, and it's a very common problem in this part of the world. That is male chest enlargement. We technically call it Gynecomastia. So, what is it? How does it occur? What are the kinds? And which all types of Gynecomastia can be treated medically? And which all kinds of Gynecomastia needs surgical treatment? The timing of treatment, the types of treatment, and how is the treatment implemented and how much time it takes to recovery. So these are the things which we're going to discuss today. What is Gynecomastia? So Gynecomastia is a condition in which the male chest enlarges out of proportion to the normal chest size, and they have that for a longer time. So to call it a Gynecomastia, they have to have that chest enlargement for more than 1 to 2 years. Then only you can call it a pathological condition or as a problem or a medical problem. So it usually occurs at the age of 13 to 14 years, and when they enter the pubertal phase. So during that they will have hormonal changes, and there is something called pubertal Gynecomastia, and it is very common, and it's not a medical condition, it's physiological for them to have a chest enlargement, and it usually disappears by itself. So if that problem doesn't disappear after the age of 16, or it continues with them to the age of 18 or 20, then it becomes a major concern. So at that point, when they start wearing t-shirts, or they go out to the beaches, or to the swimming pool, they get very conscious about their chest, which is enlarged out of proportion to the rest of the body. So then they approach doctors to find out what is the cause. So to be frank, even though it's related to the hormonal changes and the male hormone, the most of the times, like more than 85% to 90% of the cases which we see are idiopathic. Idiopathic means there are no specific reasons for that to occur. It can be environmental, it can be related to food, it can be related to ethnicity, and so many other things. So we cannot specifically point out what is the cause, but it is, it's a combination of all these. But still, in our part of the world, like in Asia and especially the South India, the incidence of Gynecomastia or male chest enlargement is very common. So when you consider a treatment for Gynecomastia, as I told you, if you have a chest enlargement during that age time, and for this many years it's fine. So if you cross that period, what will you do? So then you have to find out whether it has a medical cause or it is idiopathic. So to find out whether it has a medical cause, it can be done by a clinical examination by a trained clinician who sees frequently these kind of clients, or who are providing treatment for their similar problem. So they can examine you and tell whether this is because of a pathological cause, like any hormonal changes, or any lack of male hormone, or any excess of female hormone, like that. Even though it's a very small proportion, it's very important to rule out those clients who have hormonal changes as a cause for Gynecomastia, because if they undergo any treatment like surgery, they have a high chance of having a re-enlargement of the breast after surgery if the hormonal problem is not addressed. So ideally, after seeing the doctor, do a clinical examination. If needed, go for a hormonal profiling. If needed, go for an ultrasound of the chest to rule out that you don't have any pathological cause. And there is a grading for Gynecomastia like 1, 2A, 2B and 3 and all. So anything more than a 2A grade, the treatment, a definite treatment for that will be a surgery if there is no hormonal cause. And the surgery is a daycare surgery in which the client comes in on the day of surgery morning, and the decision is taken by a discussion between the doctor and the surgeon that whether he needs only fat removal or a fat removal followed by a gland removal, which is called a Webster procedure. Most of the clients, like say roughly 70 to 80% of clients, they need gland removal after the liposuction. We usually, when we discuss, we'll make a plan considering how much gland the patient has and how much fat is there. We can decide whether, we can roughly say whether they will need only liposuction or a liposuction plus Webster procedure. So together liposuction and Webster, it takes around 45 minutes to 1 hour surgery. And after the surgery, they will be kept under observation for 2 hours. Then we'll start the liquids, the solids, and they'll be given painkillers to take care of the initial pain as they come out of the anesthesia. And usually the client get discharged within 3 to 4 hours after surgery on the same day, and they will visit us again on 5th day to have the next examination. And the most important thing after a gynecomastia surgery is wearing a pressure garment which gives uniform compression to all these operated regions and which helps to manage the excess skin in that client. So that's very important to have a pressure garment worn at least for 1 month and preferably for a continuous 3 months after the surgery for the chest. The next question usually clients ask is within how much time they can go back to their regular work and within how much time they can go to their gym back. To their regular work, they can see if it is not too strenuous, you can start working from the 3 to 5 days. And if it's a kind of little strenuous work which needs some travel, lifting of some heavy weight, maybe it's better for them to wait for 5 to 7 days after the surgery. Another question which is commonly asked is what are the complications after the surgery? Sometimes 1 out of roughly 25 patients may have a seroma or a collection after the surgery. Usually when we aspirate once after the surgery, it won't recollect and they will not have any problem. And the next question is about the scars. Usually it is done as a keyhole surgery if it is liposuction alone, so there won't be any visible scars. And in Cosmetic, what we do something different is we keep only an incision in the axilla, in the armpit, as a 3 millimeter port, and we don't keep the chest port for liposuction. So the client will not have any scars on the chest if they undergo only liposuction. And the second port we keep it on the areola, that's a dark region around the nipple. So that is also, the scars are hidden because of the color. And only in clients who need to go in for a Webster procedure, they will have a small incision on the lateral side, on the sides of the areola, around 2 to 3 centimeter size. Through that we remove the glands, and it will have some subcuticular stitches, that is the stitches put under the skin. So that won't be visible and there is no stitch removal for that. The final question usually asked by a specific group of clients is, Doctor, whether it can be reduced by exercise and diet alone. And we often get clients who are gym trainers and they are bodybuilders, they come in for this surgery. And those who have undergone a considerable exercise and reduce their body fat, they will have only a gland which is in the tip of the breast mount. So those clients who can be managed without liposuction with the gland excision alone, that is for the bodybuilders. And the answer to the next question, whether you can manage it by diet and exercise, the fat in the chest can be managed by diet and exercise alone in some clients who have fat alone, and many of the clients, they have gland also along with that. So the chest size can be reduced by exercise, and in some clients the major component will be gland. In them the only option will be surgery to reduce the chest. So I hope I have covered most of the important doubts regarding the problem gynecomastia or male chest enlargement. If you have any further queries, you can ask us in the comment box, or you can send us an email in the email provider, or you can call us in the number provided. So thank you. Thanks for watching.